Good morning, everyone.
I am. Good
There you are,
morning.
Jess.
I finally got to come on camera.
Good morning, everybody. Good to see you all this morning. My name is Joe Gallant. I am the Outreach and Advocacy Coordinator with Kids Win Missouri, and this is our Children's Health and Mental Health Workshop for Child Advocacy Day 2025. So, really appreciate you all joining us this morning. We've got really a great agenda, lots of information that we want to get through. But really, we want to focus on updates at the federal and state level, and then some programs and opportunities that we're having coming up in our state with regards to children's health and mental health. So it's great to see folks here. Um, Really quick, want to thank our champion of for Child Advocacy Day 2025. As you can see them up there, we couldn't be able to put on these workshops and Child Advocacy Day itself without the help of these amazing organizations, as well as our gold and silver sponsors as well. So shout out to all of these incredible organizations across the state of Missouri, and some of them are federal organizations that we're able to work with as well. So really, really grateful for all of these folks to help us put these amazing workshops on and have an amazing day in the Capitol on April 2nd. So really quickly going through the agenda, since we do have such a lot of information to get through in this workshop, and we want to make sure that there's plenty of time for folks to ask questions of our amazing presenters that we have today. I would love it if everybody could take a second and just introduce themselves in the chat box and let us know who you are and what organization you're with. Or if you're just joining as an individual, that's totally fine as well. But we'd love to be able to see who's joining us and where you are in the state as well. So if you wouldn't mind sharing that information for us in the chat, that would be great. To kick things off today, we're going to talk about just a few reminders for Child Advocacy Day, which again is on Wednesday, the 2nd. So a week from yesterday. It's going to come up very, very quickly. We're very, very excited to be able to host that in the Capitol and look forward to seeing folks there. Um, After that, we have a really, really informational presentation from Trisha Brooks at Georgetown University's Court School of Public Policy, excuse me. And she's going to talk about Medicaid for kids, some of the things that are happening at the federal level and what that could potentially mean for our state as well. And then after that, we have Denise McDrummond, who is the executive director of the Missouri Association for Infant and Early Childhood Mental Health, who's going to talk about some of the goals and aims of MOAIM as an organization, as well as the endorsement process, which is really an exciting opportunity for professionals in this space. So two really, really exciting presentations there. And then after that, we'll have plenty of time for Q&A for these presenters. So we want to get through the two presentations. And then after that, we're going to have time for folks to ask questions. So if you do have any questions that are burning, if you wouldn't mind holding on to them until the end of both presentations. And if you really want to make sure that you get that question out, definitely use the chat box and we'll make sure that we go back and read any questions that folks ask in the chat box. So really quickly, as a reminder, Child Advocacy Day is on April 2nd, 2025, which is Wednesday of next week. Registration is now closed for the event. So hopefully if you're joining us on this call and you plan on coming on the 2nd, you were able to register to do so. Um, Again, this is our 43rd year of doing Child Advocacy Day, so it's really an exciting time for us to be able to bring folks together from all over the state and meet in the Capitol and talk about issues related to kids and families and try to encourage our legislators to make sure that they're passing policies that are helpful for our kids and families in our state. So, a few things really quickly, just going over some of the expectations of Child Advocacy Day. We're going to have a rally in the Rotunda, followed by our legislative visits. Throughout the day, there will be informational booths where folks can pick up literature from different state and local entities and connect with other advocates and gather resources from them as well. There's going to be plenty of chances for photo ops. We're sharing the day with the Conservation Federation of Missouri, so there's going to be a bald eagle in the building, which is pretty cool. And then after the legislative visits, which will basically take up the bulk of the morning along with the rally, we will then have a lunch at the Mill Bottom. And that's provided for all those who have registered by Kids Win. So folks can make their way to the Mill Bottom. And while we're there, we'll also be having a chat with the Department of Elementary and Secondary Education and the Office of Childhood. And of course, you leave with a feeling of contentment, having gathered in this space with so many other advocates from across the state. And really, really an exciting day. Just a few pictures to just kind of give you an idea of what the day actually looks like for folks. As you can see, the rally is up there in the top left corner. And then informational booths and opportunities to meet with other advocates and gather resources right there on the top right. And then down at the bottom, that's what some of our legislative visits look like. Sometimes they happen in folks' offices, other times they happen out in the hallway. But either way, we have great conversations, and the legislators are usually very excited to see so many advocates there to talk about issues regarding kids and families. So if you do have any questions about Child Advocacy Day, please reach out to my colleague Jessica Tran at Kids Win. I know that she'd be more than happy to answer any questions for you, or really reach out to any of us, any of the staff at Kids Win. We're happy to answer any questions for you or try to track down an answer for you. So please don't hesitate to reach out to Jessica or anybody else that you might have contact with. All righty. So I'm going to go ahead and kick it over to Tricia Brooks, who is joining us again from Georgetown University McCourt School of Public Policy in their Center for Children and Families. And she's going to talk about some of the things that we're hearing from the federal level with regards to Medicaid cuts and what that could mean for children, not only across the country, but specifically here in Missouri as well. So, Tricia, if you're ready, you can go ahead and take it away.
Thank you so much, Joe. And I'm really excited that Kids Win is continuing this work at the advocacy level because it's more important than ever for the health and well-being of children and families in the state. You can move on to the next slide, please. So Medicaid has many roles, and I think you all know many of these, but currently, that shouldn't be a dollar sign in front of 562,000 children, but Medicaid and CHIP do cover over 500,000 kids in Missouri. And it also covers over 40% of Missouri births. Medicaid, and we'll talk more about this later on with the other presenter, but also in my comments, Medicaid's the largest funder of substance abuse treatment and mental health services. And we know that Medicaid boosts family financial security. It's not just about the kids having their own health insurance. It's about the family being insured and not being at risk for medical debt. We also know that Medicaid is really important to rural areas, and this will just give you a sense of rural hospitals potentially at risk and certainly would be at risk with more cuts to Medicaid. We know that Missouri has lost 10 rural hospitals in the past few years, and one hospital closed its inpatient services. That leaves 58 rural hospitals in Missouri. 28 of them are already operating at a loss. And 27 of those are considered at risk for closure, and 11 in particular are at immediate risk of closure. So it's really, really a big deal when it comes to rural access. Medicaid also pays for 65% of nursing home residents in the state. And it plays a really key role in pandemics. We saw that with HIV and AIDS. We've seen it with COVID. We see it with hurricanes and floods. And it allows states to step in and do more when something bad is happening to the health of the people. Next slide, please. I'm going to spend just a little bit of time on this slide because it is really an important piece to remember. While Medicaid serves certainly our seniors, people with disabilities, adults, it's particularly important for child health. First of all, Medicaid provides coverage for prenatal labor and delivery services, as well as 12 months postpartum care. It also covers early term or low birth weight and neonatal intensive care. And we know that Medicaid's comprehensive EPSDT, which stands for Early Periodic Screening, Diagnosis, and Treatment, which is really focused on identifying where a child might have a developmental delay that can be addressed, certainly, hopefully, before they go to school. And those are often addressed in early intervention services, which do help kids, not only preterm kids, but kids with hearing loss, Down syndrome kids, those kinds of kids to be able to overcome some of their disabilities or augment them and be able to go to school ready to learn. Medicaid covers a lot of our kids with special health care needs. We know that 1 in 5 children and youth have a special health care need, and half of them are served in Medicaid. And in particular, Medicaid's really important to families in crisis when you talk about mental health and substance use services for parents who potentially have issues with neglect and abuse of their children who could end up in the child welfare system. It's also important to those who take over foster kids, making sure those kids have access to services when they're in foster care and helping families with kinship care. We have about a third of children in foster care actually are cared for by kin. It's also important for these children to have permanent adoption if they don't go back to their homes, so that Medicaid continues to cover those services. Medicaid's also really important for school-based health, both in terms of supporting your individual education plans for kids with disabilities, but also we are seeing more and more investment in school-based health access, particularly around mental health. We know that Medicaid does a lot to help families keep their kids in the home, kids with disabilities who can stay in their homes, but really do need an institutional level of care. And interestingly enough, this is a tidbit I learned recently, that even though children in military families are covered by TRICARE, 10% of them are also enrolled in Medicaid, because TRICARE doesn't cover, for example, well child care for free. It also helps with targeted case management, which flows into this home visiting and other services that are provided to high needs families, pays for family planning before and between pregnancies. It offers stability for low income families, reducing that medical debt, covering those mental health and substance use disorders for parents. And we know that Medicaid has improved long-term child health outcomes, not only in improved health or lower levels of disability in adulthood, but greater educational attainment that plays into their economic success in life. Next slide, please. So before we jump into what's happening at the federal level, I think it's helpful to just do a quick overview of how Medicaid is financed. So technically, Medicaid is not subject to annual congressional discretionary appropriations because it's an entitlement. It's open-ended financing for the states. If a state enrolls an eligible person, pays for services, or pays capitation rates, then the federal government is going to pick up a fixed percentage of those state costs. Now, your regular federal Medicaid matching rate, which is called FMAP, and I'll talk about this a good bit later on, varies from state to state from 50 to 85%. In Missouri, your regular traditional Medicaid is funded in the upcoming federal fiscal year at 64.44%. And then we know that there has to be matching contributions from the state. Next slide, please. And these are Missouri's current matching rates. So you have Medicaid at the 64.41, but your adult expansion, which was very intentional in terms of incentivizing states to expand coverage to low-income adults, is at 90%. And that's a big bone of contention right now on Capitol Hill. Most administrative costs are reimbursed at 50%, but those activities related to program integrity are covered at 75%. And then your kids in CHIP are covered at a little over 75%. Next slide, please. So what does this mean for Missouri? It means for every dollar that the state invests in Medicaid, it leverages $1.81 in federal funding, which means that that dollar supports a total investment of $2.81 dollars for people that are enrolled for all the services that are covered in Missouri by Medicaid. Next slide, please. And in fact, Medicaid is the largest source of federal funding for Missouri and every other state. This is a little higher for Missouri than other states, but 62% of the federal funds flowing into Missouri come for Medicaid. And the other spending, 38%, that includes everything, your K through 12 education, your roads, transportation, higher education, corrections, public assistance, and all other forms of federal funding. So a hit to Medicaid funding is a hit to the state budget and to the state economy. Next slide, please. Now, normally, when legislation is passed at the congressional level, it requires 60 votes in the Senate. It only requires a simple majority in the House, but 60 votes in the Senate. However, the Republicans do not have 60 votes in the Senate. So that negates going through what's considered regular legislation, which is, for example, subject to filibusters in the Senate. So the Congress is using a tool called budget reconciliation. It only requires a simple majority. However, budget reconciliation can only have provisions in it that impact spending or the budget in some way, certain tax, spending, and debt limit legislation. But Social Security is specifically exempt from budget reconciliation. And as I mentioned before, it's not subject to filibuster. So things can be rammed through when there's a simple majority to do that. Next slide, please. So here's getting into where we stand today. The House budget framework, their resolution, which is the starting point in the budget reconciliation process, calls for $880 billion in health cuts. That's 57%, over half of the $1.5 trillion that they are looking to cut out of the budget. And if this is approved by the House, then that means that the committees in the appropriate jurisdictions have to cut those levels of funds. So $880 billion in health cuts. Medicare's already off the table, so most of this would fall to Medicaid. These spending cuts are helping to pay for $4.5 trillion in tax cuts for wealthy corporations and billionaires. And it will only add to the nation's debt. Now, the full House has approved this budget reconciliation, our budget resolution. However, there was a behind-the-scenes agreement with the Freedom Caucus that they're actually going to cut $2 trillion. Or if they don't, they're not going to be able to get the tax cuts that they're looking for. Now, the committees were supposed to report out their reconciliation policies as of today, but we do not think that that is happening. That's certainly been pushed into April and possibly after the Easter recess. But the magnitude of these cuts suggests that major structural changes are on the table, whether they be per capita caps, changes to the Medicaid reimbursement, the federal share, work requirements, limits on provider taxes, or repealing certain rules. Next slide, please. Now, the Senate took a slightly different approach. Instead of saying you got to cut $1.5 trillion out of the budget, we only want you to do something that is at least 1 billion. That really allows them to sort of hide the ball, right? And they're saying at least 1 billion compared to 1.5 trillion. So that's a floor. It's going to grow. And we may not hear more details on that until we start to see actual bill language. And the Senate approved this framework in February. And again, we'll talk more about the timeline for what happens next in a few minutes. Next slide, please. So these numbers are taken directly from what was put together in the House Ways and Means Committee. It's called a reconciliation menu. It gives you an idea of how much savings could be seen with cuts to certain things. So if you were to implement Medicaid per capita caps, you could take care of that whole 880 billion because that would reduce federal spending by 900 billion. You could equalize that match for the adult expansion population that's currently at 90%. It could go down to the 64%. You could decide that this matching rate of it's a floor of 50%. The federal government kicks in 50% for at least everything in every state. You could lower that floor. That would save 387 billion. Limits on provider taxes, which Missouri relies on heavily to help fund Medicaid, 175 billion, and the list goes on. So next slide, please, because I'm going to talk about where we stand with some of these cuts. Now, after some pushback from the early rounds of advocacy on the federal budget, you had President Trump saying that he was going to protect and cherish Medicaid. And as a result, Mike Johnson, Speaker of the House, came out and said that across the board, Medicaid per capita caps are off the table. He also said that they weren't going to change anything on the FMAPs, but there continues to be talk about reducing that FMAP for the Medicaid expansion from 90% to traditional match. But if the big things are off the table, that means they have to combine a bunch of little things in order to hit that $880 billion target. Next slide, please. Now, even though they've said they're not going to change this, just so you know, if they were to reduce the adult FMAP, it would cost the state $7.3 billion to cover the federal share over 10 years. If they were unable to maintain that, if the state isn't going to be able to come up with that amount of money, it could, and they got rid of Medicaid expansion, it could result in the loss of 362,000 Missourians, parents and adults without dependent children, which it would be a 26% decrease in enrollment. And the Urban Institute has recently put out new information suggesting that the uninsurance rate in Missouri would grow from 8.8% to 11.7%. And it certainly would reverse the gains that we've seen in family financial security, the access to care, and health outcomes. Next slide, please. One of the big things that are being talked about are work requirements. And those only come in at about $100 billion. They could be made mandatory in order to reach that full 100 billion. But they cost a lot to administer. It's just more red tape and administrative burden for the states as well as beneficiaries. Now, some states are proposing that you could figure out a way that you wouldn't have to have people reporting that they're working. This was something that occurred in Arkansas when there was a test of work requirements, and something like 18,000 people lost coverage within the first few months because they were unable to report it. Um, and and yet, even if work requirements aren't in the final budget reconciliation, it could be that they would be approved under Section 1115 waivers. Now, this is something that House Speaker Mike Johnson has repeated over and over again, and I'll just give you a different way he's quoted it. You don't want able-bodied workers on a program that is intended, for example, for single mothers with two small children who is just trying to make it. This is not what Medicaid is for. Not for 29-year-old males sitting on their couches playing video games. So there's a real misconception about who's on Medicaid and what work is all about. There's also some confusion about how this would play out in Missouri, because your ballot initiative had specific language in there about not imposing more onerous administrative requirements on the adult population. But if it's mandatory at the federal level, the state may not be protected based on that ballot language. I'm not an attorney. I'm not making a prediction here, but it's just something that we need to be mindful of. Next slide, please. So the other potential hit could be to limit state provider taxes. So all states except for Alaska have at least one type of provider tax where they're taxing some type of health-related services. So you have almost all states taxing nursing home facilities, almost all states taxing hospitals, about 2/3 of the states intermediate care facilities, and not and less than half for managed care organizations. So the Kaiser Foundation, Family Foundation, just put out information on this. Currently, the provider taxes have been allowed for 40 years, but in the 90s, there were limits imposed. So currently, provider taxes can be no more than 6%. And as you can see here, Missouri has greater than 5.5% for nursing facilities and intermediate care facilities. And the talk is to reduce that federal cap to either 5% or potentially going as low as 2.5%. So that would even impact your hospital rate as well. Now, Missouri, in 2018, that was the most recent data I could find, collected $1.14 billion in provider taxes to help pay for Medicaid in various ways. And the state does have the three types that I've listed in the chart. That's a big hit to the state budget. And I'm not sure that based on the budget conversations in your state that we're going to see the state be able to raise other taxes to cover any reductions there. Next slide, please. So there are very few choices that states have when there are federal funding cuts. They can boost state revenues, they can tax things, but more importantly, they will be given, under the guise of flexibility, the ability to do things like close or cap enrollment, impose harder restrictions on enrollment and renewal, reduce eligibility levels, cut benefits, increase what individuals have to pay, or lower provider rates. And there could be other cuts to state budget to offset. Next slide, please. So what's going to happen next? Immediately, there's an urgent threat to try to change these numbers in the budget resolution. We don't want to see $880 billion in cuts to health programs. Now, there will need to be eventually a joint budget reconciliation in the House and the Senate, but they've got a lot to reconcile between what is being discussed. And in fact, we've heard numbers coming out of the Senate more in the limiting health cuts to more than 500 billion, but still, that's a big hit to Medicaid. But they have to come up with this joint budget resolution before they can move on the legislation to enact it. Next slide, please. After that, we still have other subsequent threats. The debt ceiling is going to have to be increased again, depending on expenditures sometime in the summer, early fall. And if they get one reconciliation bill done this year, it's possible for them to come back in the fall and do another one, which would have additional cuts. And then at the end of the year, there are always extenders, healthcare extenders. There has to be funding packages that keeps the government operating and appropriates certain discretionary funds. However, those do require 60 votes in the Senate. Next slide, please. So what can you do? And I'm going to wrap up with this slide. It's really important to educate policymakers and key decision makers about the value of Medicaid and what it means for your community. And also to highlight the harmful impacts that it would have on individuals and families. And not just the people who are served by the program, but the healthcare economy, the state budget, the state economy. Use your coalition tables and partners to raise awareness and to highlight the importance of Medicaid for young children. And not only young children, but also for the childcare workforce, for schools, for long-term care. It affects so many different sectors. And then to echo national advocacy groups seeking to keep Medicaid off the table in budget reconciliation, and partnering with other groups that represent the full spectrum of Medicaid. So your hospitals, your education leaders, all of those different sectors to demonstrate that the cuts would hurt not only individuals, but would hurt efforts that are going on in various sectors to provide services to children and families. And the next couple of slides, you can just get through those so we can transfer over to our next speaker. But I've just listed some resources here. They have links, and I am happy for Joe to share the presentation with enrollees or attendees after the fact. I look forward to further discussion.
Thank you so much, Tricia. And yes, these will all be shared with everybody. So you will have access to all of this information as well as the links that Tricia so graciously provided here at the end of the presentation. I know that was lots and lots of information. So hopefully, folks, if you were able to think of any questions that you'd maybe like to ask Tricia at the end of our workshop here, I really hope that you hold on to those and we can try to get those answered for you. Moving along, since we are just a little bit over time, our next presenter is Denise McDrummond, who is the Executive Director for the Missouri Association for Infant and Early Childhood Mental Health. MOAIM is an organization that is here in the state that is really doing some amazing things with regards to infant and early childhood mental health and connecting families with resources regarding mental health. So I'm going to kick it over to her and let her talk a little bit about the association and some of the things that they've got going on and some opportunities that you might be interested in. So Denise, whenever you're ready.
Thanks, Joe. So yes, we are a statewide organization, nonprofit, that we refer to as MOAIM because the Missouri Association for Infant and Early Childhood Mental Health is just way too long to say. So we'll just call it MOAIM. So it was founded in 2015 as an organization, developed its nonprofit status. And you can see that we are celebrating our 10-year anniversary, which is pretty exciting for us. So as we have grown and changed, so we established in 2015. In 2017, we actually became a part of the Alliance for the Advancement of Infant and Early Childhood Mental Health, which was a huge stepping stone in the life of MoAIM. So, and since then, we have been able to do some very exciting things, including endorsement, which we're going to talk about here in just a minute. So, all right, Joe, go ahead and advance. And so the vision and mission of MoAIM, that is something that we do enjoy sharing because it's important that everyone knows where we come from and where we stand. So really and truly, we want all of Missouri children to have these services and support and everything that they need to survive and thrive. It's not just about making it day to day, it's about really growing and learning day to day. Our mission is to optimize well-being in the early years by promoting those first relationships and advancing effective infant and early childhood mental health development practices. And we do that through really working with professionals who support families and children. So we do that through resources, and endorsement is one of our resources. We do it through trainings and various opportunities. So we want to make sure that children and families can grow in Missouri. All right, go ahead, Joe. So infant and early childhood mental health. I think most of you are aware of what it is, so I feel like I'm kind of preaching to the choir. But the 0 to 3 definition is the developing capacity of a child from birth to from birth to 5, and we usually work from till about 6 years old for our purposes. But to develop and grow socially and emotionally through secure and close relationships with adults, peers, and caregivers. To experience, express, and actually understand all the emotions that come along as they grow, because we know that children have big emotions, they have big feelings, and to be able to explore and learn in an environment that's safe and secure, because without trust and without relationships, children won't be able to branch out and to grow. They won't be able to explore and learn. They're not going to have that ability to understand the emotions that they're experiencing, much less be able to express them in ways that are acceptable and manageable. So all of those things are done in the context of family, community, and culture, because that is infant and early childhood mental health. So as we move on, go ahead. One of the things that we really look at as far as infant mental health is that generational trauma that comes with it. So it can be passed. We know it can be passed through generations, and we understand that the process of that is not just an emotional or mental thing. It actually is a physical trauma as well that can be passed down through generations. We know that children who are have trauma are more likely to experience PTSD when their caregivers are not regulated as well. So taking care of caregivers, taking care of the adults in our children's lives is incredibly important to the child's own safety and infant mental health. So we understand that when they're supported, when caregivers are supported, children have better outcomes, right? And that's what you guys are all doing. You are working to ensure that those people who are surrounding children are taken care of as well. And because you're doing that, those children are going to be taken care of. So we want those better outcomes for our children. So why is it so important? Why is infant mental health so important? When we look at it, secure and responsive relationships between toddlers and a caregiver really is the foundation of mental health in its earliest years. It just is. Healthy social and emotional development flourishes when children feel safe and supported and valued by the adults around them. And we know that it gets a little interesting. People think of mental health and infant mental health as First one of the babies on couches. And we know that's not the case. It's not a psychotherapy, it's not a diagnosis. It really is the relationships that surround our children that we are concerned about. Because when those relationships are healthy, our children are going to be healthy. So infant mental health really highlights those attachments and connections for children. We know that it's, like I said, it is the very foundation of all learning, because all these things that happen in these first few years are going to affect our children for years to come. So go ahead, Jeff. So those practices, I said, that is not just babies on couches. It's not just seeing a child in that respect. It really is indirect services. So again, supporting the relationships that surround our children, working with providers who serve infants and young children rather than that direct mental health service. So practitioners work on multiple levels to address systemic issues, including equity and diversity, and they build that workforce capacity to create nurturing, healthy relationships. And it's important that those things surround our kids. And one of the ways that we are able to do that, one of the ways that we are able to work and support those people who are surrounding our children, whether it's clinicians, early interventionists, childcare providers, home visiting, whatever that may be, whatever professional is surrounding your family and your children, we're supporting. MOAIM works to support those people. And one of the ways that we are able to do that, go ahead and move on to that next slide, Joe, is through endorsement. And we are, whoops, I'm sorry, I pushed you too far. Sorry. One of the ways we do that is through endorsement. Endorsement is new to Missouri. It's not a new concept by any means, but it is new to Missouri. Endorsement's an internationally recognized credential that supports and recognizes experience. It recognizes knowledge and proficiency of professionals who work with or on behalf of infants, young children, and families in Missouri. It's an amazing, I feel very strongly about endorsement because that's where my background is. But it is something that really can create specialized workforce. It helps to create, actually, it is probably the largest workforce initiative, infant and early childhood workforce initiative, nationally and internationally. So it identifies those best practices across disciplines and settings. So best practices from, in the classroom with children, through clinicians who are working with children, through home visitors, all of them. It identifies those best practices that support the mental health of our children. Earning the credential can actually assist professionals in integrating infant early childhood mental health informed principles into their practice, things like reflective practice, relationship-based approaches. This integration actually has a truly profound impact on the social and emotional well-being of infants and young children, which of course, again, sets that foundation for lifelong learning. And the use of endorsement really does reflect Missouri's commitment to best practices in the infant and early childhood field. It provides credibility. It engages professionals in supporting young children's social and emotional well-being, and it formally recognizes the infant and early childhood mental health field expertise in Missouri. Go ahead. So, sorry, Joe, I keep crossing my slides. Go ahead back to the state. I want to show that one. Yeah. So you see, this is a map. The green states actually are part of what we call the Alliance for the Advancement of Infant Mental Health. Missouri is part of that. The beautiful thing about looking at these states, it shows that it truly is an international program. So truly, Ireland, Australia, Japan, and Puerto Rico are working to bring it to their countries, but it is currently in 36 states across the nation. Between those states, there is reciprocity. So if you earn your endorsement in Missouri and you move to Oklahoma, your endorsement goes with you. Um, and when you're earning your endorsement, by earning this, it really helps professionals to expand their skills and their knowledge. They really become those key partners in the mission to strengthen early relational health, to really foster those meaningful connections and promote lifelong positive outcomes. Cannot say that enough. That expertise really magnifies your collective impact because you can see all of these states coming together to focus on one big push for children and families. So in this endorsement process provides a framework for professional development, for really equipping professionals with the knowledge and the skills to support infant and early childhood mental health. So when you're looking at all of these states, they work together. We come together. We actually really come and provide that unique look at infant and early childhood mental health. All right, Joe, go ahead. Trying to rush through this. I'm sorry. So endorsement in Missouri, what does that look like? It is creating that specialized workforce. Yes, we will make sure that you get all that information. This is information you can see from last year, has not been updated, but they kicked off endorsement in 2023 with a group of leaders that walked through the process to bring it so that everyone has this opportunity. It is open and available to all professionals right now in Missouri who work with or on behalf of infants, young children, and families. So really, that's all of you. All of you are doing this work. And endorsement itself, when you go in and you apply for endorsement, it's not asking you to go and do things. It's taking what you have done, all the trainings that you have done in your career, all of your education from your career, and really highlighting it in one place to show your overall knowledge and skills in this work. So you're not asked to do more. You're just putting it into one place to actually show what you can do and that you have this information. So after they established that leadership cohort, it opened to the state in the fall of 2024. So it has just been open very recently, but it is exciting because it is open and available to all of you. And I think on the next slide, it kind of shows you how you can look at this information. So there's a lot of ways that you can become involved with MOAIM, and we encourage everyone to be involved in some way. You can become a member, which you should be a member. It's a professional organization. Um, and we understand that being involved with these professional organizations really does help to not only give you some of that credibility and validity to your profession, it actually helps to align your practice with groups of people that are doing the same thing and really working towards that same goal. So be a member, become a member, be a part of this movement to improve infant and early childhood mental health in the state of Missouri. You can join one of the committees. We have multiple committees that you can be a part of to help shape Missouri's future in this field. You can join our gatherings. We have monthly gatherings the second Friday of the month at 11 a.m. They are free. They are aligned with MOPED, so you get your CEUs. But they are free opportunities to learn more about infant and early childhood mental health, all the aspects of it in Missouri. So we would encourage you to be a part of MOAIM and to really enjoy and learn what you can do to move this field forward in Missouri. And then I think that last slide, this is a link. It's an easy QR link that takes you to our website that shows you all the upcoming events and other ways that you can be involved. So I definitely encourage you to do that. And I hope I've left enough time for everybody's to ask questions if they need to. Yeah.
Thank you so much, Denise. Really, really awesome information and so proud of the work that MOAIM is doing in our state. And yes, please, everybody utilize this QR code so that you can learn more information about MOAIM and get connected with folks who are involved in the organization. And we do have about 11 minutes left, so I want to leave that time for folks to ask questions of either one of our presenters. So if you have questions, for Tricia regarding some of the Medicaid information that she was able to present, or if you have questions about MOAIM for Denise, now's the time to raise your hand and ask away. And I know that we've got some stuff going on in the chat as well, so I just want to check on that and see what we've got going on. Really great. And I'm glad that folks are taking time to also answer questions for each other in the chat. That's really helpful as well. So if you do have an answer to any of these questions, it's really awesome if you're helping out in the chat. Um, but yes, anybody who has any questions about any of the information that was presented today, now is the time to ask away. Or if you just had a comment or wanted to elevate anything in regards to your thoughts on what's going on with Medicaid or what's going on in the infant and early childhood mental health space, we would love to hear it.
So,
Let's
Joe,
see.
I might want to comment on one of the comments in the chat was, how about we keep to kids and quit complaining about billionaires and corporations? And um, there's been a lot of polling that's been done to determine what messages resonate with policymakers. And what resonates very strongly is countering this idea that the programs have a huge amount of waste and abuse, to talking about their value, and that the reason we are talking about cuts is so that we can fund or continue those tax cuts for corporations and for very wealthy individuals. So basically, the advice of talking about it that way is that it does resonate with people.
Thank you for that, Tricia. Yeah, and I think it's also just important to objectively acknowledge, like when we're talking about making really egregious cuts to health access for really vulnerable populations, who benefits from that at the end of the day? I think it is important to try and acknowledge those things and definitely try to filter through what the effective messaging around all of that is, especially as these things are under a pretty serious threat right now. So I totally understand. Like, we definitely want to make sure that we are keeping these conversations with kids at the forefront. And I think just acknowledging objectively what is actually happening is an important way to do that as well. So I appreciate the question as well, because it is an important part of this conversation, honestly. So really appreciate that and appreciate your answer as well, Tricia. Um, any other questions or comments? I did see Rachel Gabriel, excuse me, asked, is it true Medicaid can provide transportation to school for families with transportation issues to help minimize truancy, perhaps?
So I saw that question. I'm not sure that I can give you a definitive answer. As I understand it, certainly Medicaid will pay for transportation to healthcare services. But I don't believe that that includes transportation to schools when there are other challenges. I don't know, for example, if Medicaid pays for the special vans that pick up kids with disabilities. That's something I think we'd have to look further into.
Thanks, Tricia. Yeah, and I'm happy to look deeper into that for you, Rachel, and get you an answer on that as well. Let's see if we have other questions. I did see, how is it best to support children who did not get the access to early childhood and are now 9, 10, 11, showing mental health issues, causing acting out, dysregulation, etc.? These children are in schools having difficulties, so how to get them well and successful? And Denise, I think that's a question really more directed to you. So if you want to speak on that at all, on how, like, if you're aware of, or if anybody on the call is aware of what resources are out there for kids who otherwise maybe would have benefited from some sort of attention in early childhood with regards to mental health, but are now school aged and trying to work through their schooling and are having difficulty with that. So, is there anything you might want to speak on to
Right.
that?
Well, I wish I could speak better. I will say that. All honesty, I am new to Missouri, so I am not fully aware of the resources yet. That is my big learning curve. I come from Tennessee that I finally learned all theirs. Totally different acronyms here, people. Completely different. And there's so many. I do know that there are resources available, and we do have resources listed on our website that you can go to that might provide you some of that information. Um, and really, that's a hard one. And I am not a clinician, so I'm not going to speak to that as such. But I can say that if you go to the website and look at some of those resources, or send us an email, send me an email, and I can at least push that forward to somebody who might would actually know those resources a little bit better. So I am sorry that I don't have that knowledge right now beyond, hey, look at the resources, which is really lousy, and I'm sorry for that. So,
No,
but
that's okay. That's okay,
I'm
Denise.
learning.
And we know that you're new to Missouri, and we appreciate all, you making the move over here because you're such a great wealth of knowledge. And Rachel, I would be happy to follow up on what resources might honestly exist
Mhm.
um, already. But I would also just say that this is part of the reason why we are really pushing and advocating for endorsement in our state, because endorsement connects professionals across multiple different disciplines and multiple different fields that touch the lives of kids and families in that early childhood and infant time in their lives. And so then, like, the endorsement process also allows for professionals to get connected to one another so that when we are dealing with a specific family and specific issues with regards to mental health or with regards to physical health and with regards to family health in general, and kind of taking that broader holistic approach to it across multiple different disciplines, it makes it a lot easier for us to identify what would actually help this kiddo who is now in school. They're doing the best that they can to make it through things, but they're just having a little bit a difficulty that maybe could have been addressed early on in their lifespan. But now this is what we're dealing with now, and we need to figure out um, how we can best address that. So I really think that all the more reason why we hope to see more professionals in our state become endorsed. Again, it's one of those things that it's across multiple different disciplines. It's not just for therapists and psychologists. It's endorsement really. It's for medical professionals. It's for folks that are in the policy space and advocating for policies around infant and early childhood mental health. So really something to look into and see how we can continue to push that initiative forward in our state. Any other questions, comments, concerns? And again, greatly appreciate the conversations happening in the chat as well. Um, yeah, I agree. I think that the messaging around all of these things, particularly with regards to the Medicaid cuts, it is really important to keep in mind the audience that we have. And with that said, like, keep in mind the priority that we're actually talking about here, which are children who have not asked to be in the situations that they're in. No child asks to be in the situation that they're in, particularly ones who are in incredibly vulnerable situations. And if we can support them as a state, as a country, as a community, whatever we can do to highlight what threats there might be to supporting them, I think is really important. And I think making sure that we do that objectively without necessarily attacking and without necessarily pointing the finger at one particular issue, because of course we know that there's not just one particular issue that affects kids and families in our state. So bearing that in mind when we're having these conversations and when we're addressing folks across the aisle politically, I think we all hopefully have a shared investment in not only our children's futures, but our futures as well. I mean, we're like in shaping our children's futures, we are absolutely shaping our own. So bearing in mind that, kids are going to be the ones that take care of us at the end of the day and are going to be the ones that really take over this world is something that we want to make sure that they are absolutely as well supported as possible. And any way that we can do that, through these initiatives, whether it be ensuring that we keep Medicaid rolling here in our state and continue to elevate early childhood and infant mental health in our state. I think it's really important that we do that. Yes, and continuing to educate policymakers because they don't know what they don't know. And again, I think that all policymakers would like to consider themselves champions for children. So making sure that we give them the opportunity to do that by educating them is a great point. Um, so with that said, if you do have any other questions, let me go ahead and put my email in the chat for everybody as well, and I'd be happy to forward any questions or comments that you might have on to Denise or Trisha. Yeah, making sure I had a difficulty typing that. But that's my email in the chat. So please feel free to reach out to me. And of course, everybody who attended today will have access to the slides. And we've also recorded this meeting as well for folks. So you'll get the chance to rewatch that. And again, hope that everybody continues to fight the good fight on these issues and continues to bear down on how we can really support our kids and families in the state of Missouri and across the country and across the world, honestly. So thank you all so much for attending today. Really, really incredible information from Trisha and Denise, and greatly appreciate them joining us. And hopefully, we will see all of you on the 2nd in the Capitol. Very excited to be hosting our 43rd Child Advocacy Day in Jefferson City. We're really, really looking forward to it. And I think that the information provided here today hopefully will give folks some good talking points when they show up and talk to their legislators on Wednesday. So thank you all again, and please have a great rest of your day. And we'll see you soon.